Well, hello. It's Bruce Williams, and it's time for the final installment, part 7 in my series on the selected gross pathology of the rabbit. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues who have so generously provided me with images, which I've used over the years to put these lectures and so many others together. I couldn't have done it without you. Okay, we're going to cover up a couple of systems in this particular lesson, and we'll finish the rabbit. I'm going to go back to the respiratory system. We've already covered the most important disease of the rabbit, pasteurellosis, which is a primary respiratory disease, but we covered it in an early lecture because it hits so many different systems. So let's go back and clean up the respiratory system with a couple of other lesions. Here's a great picture from my friend Tim Cooper, and we have a diffusely enlarged lung. This lung has not collapsed. If you look carefully, you can see there are rib impressions on it. And this is a diffuse interstitial pneumonia, which is caused by Pneumocystis oryctolagii. Pneumocystis is a fungal pathogen that pretty much all mammals, including people, carry around with them in their lungs their entire lives, but it only manifests with disease when our cell-mediated immunity is so suppressed that it can no longer fight off infection. And there's a characteristic histiocytic inflammation which is associated with this lesion that under the microscope is going to look like all the alveoli are filled with little soap bubbles. You'll often see other bacterial infections associated with it because if you're that immunosuppressed, a lot of different things are going to pop up. Rabbits very commonly carry Bordetella around with them as well, and certainly Pasteurella would pick this time to rear its ugly head as well. Pneumocystis is a fungal organism, although the microscopic lesions are called cysts and trophozoites because it has bounced around into a number of different families and most recently has been re-identified as a fungus. It's probably crosses the placenta, so the animals are born with it. And these are now considered species specific, where it used to be that Pneumocystis carinii would affect all different species. They've all been broken out to Pneumocystis murus in mice, Pneumocystis cerevisiae in humans, and so on and so forth. Now in rabbits, you can occasionally see these fungal parasites visibly in the lungs at the time of weaning for a very short bit of time, and there's no associated pathology with them. You won't see that sort of flocculent soap bubble exudate, and you may see individual organisms attached to the alveolar epithelium. You can see the trophozoites here, the sort of black dots. Sometimes they're outlined by this material if you put a silver stain on it. And here's a nice low magnification picture showing the thickening of the alveolar septa as well as that flocculent soap bubble-like exudate, which is so characteristic of Pneumocystis. Whenever I see that flocculent material filling alveoli in any laboratory species, I always make sure to get a silver stain to see if you can pick up Pneumocystis in there. Unfortunately, I don't have a good gross picture. This particular agent is not seen too much anymore, but we're looking at the cilia, the ciliated border of the airway, probably down in the lungs, and you can see that there are numerous silver-positive organisms which are mixed in with the cilia, standing straight on end, and this is Carbacillus. Carbacillus got a whole lot of attention back in the 90s as one of those agents that wants nothing more out of life than to be a cilium. So it hangs out with cilia. And the other ones that you want to think about are Bordetella and Mycoplasma. You'll always find them in areas with cilia. Carbacillus is great It's silver positive, not too difficult to find. And whenever you have significant bronchiolitis in a rabbit, which could be either suppurative or lymphocytic, it's probably worth throwing a silver stain on there and looking for this particular organism. Okay, grossly, this could be a number of agents, including Pasteurella. We do have a very prominent bronchopneumonia with suppuration and collapse of the anteroventral lobes. This is sort of in upside down, but the ruler was there, so I left it in there like that. This is the only picture I have of Pseudomonas aeruginosa pneumonia in rabbits, occasionally seen in weanling rabbits. Not that big of a problem in rabbits as compared to a couple of other species like mink, where it causes a pretty significant pneumonia with high morbidity and middling mortality in young mink kits. So Pseudomonas aeruginosa. And one more cranioventral fibrinosuppurative pneumonia in rabbits that you need to be cognizant of, not so much for the rabbits, but if they're mixed with other laboratory animals like guinea pigs are highly susceptible to Bordetella. We talked about Bordetella early on in one of the early lectures as being part of a syndrome which causes atrophic rhinitis in rabbits. And it can also get down into the lungs and cause pneumonia. I think we tend to underrate the prevalence and the pathology that's associated with Bordetella in a wide range of species. We tend to think of it just as a cause of kennel cough in dogs or maybe atrophic rhinitis in pigs and rabbits. But it can do much more. And it can result in a life-threatening pneumonia in a wide range of species. And I've seen it in dogs and cats and monkeys and rabbits, and especially guinea pigs. So when we get to lectures on guinea pigs, we're going to talk about Bordetella being the bad actor in the guinea pig. It acts much like Pasteurella does in rabbits. It's that severe. So if you ever go to the pet store on Easter Sunday when they have all the bunny rabbits and the guinea pigs running around together in the front window trying to make an Easter sale to the kids walking by, make sure that you buy one of the bunny rabbits, because probably all those guinea pigs are going to be dead of bordellosis, which they got from the rabbits, in about a month. Okay, so let's talk a little bit about the reproductive system in the rabbit. This is a middle-aged rabbit. You can see sort of this bubbles within the lining of the uterus. And this is cystic endometrial hyperplasia. Williams rule of bubbles number 1 is, can't tell what organ you're in, but you're seeing a bunch of bubbles. You're probably looking at cystic endometrial hyperplasia. We see it in a large number of species, and it's very prevalent in the laboratory species as they reach middle age, probably 4 years, 3 to 4 years in a rabbit. As the levels of estrogen start to decrease, the levels of progesterone start to increase, you're going to see changes. The animals will experience significantly decreased fertility, and this is when you often may see some other diseases pop up in the rabbit, including uterine neoplasia. Okay, we're looking at a doe rabbit. Here is liver, stomach. This is the enlarged gravid uterus. There is a lot of hemorrhage, and whenever you see hemorrhage, I want you to think of necrosis. The two go together like peas and carrots. And this is a case of listeriosis, Listeria Monocytogenes. We tend to think about disease in ruminants, where we can get a wide range of disease, including septicemia and encephalitis. Well, did you know that Listeria monocytogenes was first identified in the rabbit? Usually they get it through contaminated feed. Most Listeria comes in from contaminated feed because the organism, it survives extremes in temperature. It can survive being frozen. There have been outbreaks associated with ice cream. It can survive very high or low pHs. In rabbits, Usually this is a septicemic disease which will hit the does in the late states of pregnancy. They may either die without premonition, or they may simply abort the septicemic fetus as well. Every once in a while you'll see macerated fetuses or mummies or weak babies with evidence of septicemia. And the does that survive may end up carrying the bacteria and being shedders. And here is a picture from a septicemic doe, and you can see that there are little white dots of necrosis throughout the liver. The liver is always the best place to look at most animals for necrosis that is associated with Listeria. And these are areas of necrosis. They're well demarcated. And if you put a gram stain on this, you're going to easily pick up these sort of chains or filaments of gram-positive bacteria within the necrosis. Listeria is an easy diagnosis to make, especially in a fresh carcass. Okay, great picture by Dr. Mike Eckhouse, National Institutes of Health, showing multiple neoplasms along both horns of the uterus. This is uterine carcinoma, and it is a very common neoplasm in older rabbits, with female rabbits, of course female rabbits, between the ages of 4 to 7 years, with a high incidence. Tend to see it a little bit more in the more specialized pet breeds, including the tans, which have the highest rate at about 50%, French silver, Savannahs, Dutch belteds, but you can see it in the New Zealand whites as well. We just don't see that many older laboratory rabbits. They're often multicentric in nature, involving both horns, and when you open up the lumen, you may see that the oldest parts of the tumors often have large areas of necrosis. Other parts of the uterus are often distended as a result of fluid accumulation and occasionally pyometra. These tumors arise from the deep glandular portions of the epithelium. You may see associated changes including cystic endometrial hyperplasia and adenomyosis, which are more aging changes and are probably not related to the development of the tumor, but just coincidental, because we see this in older animals. As we said before, many of these changes pop up during the years in which estrogen levels are waning. Progesterone levels seem to be on the increase. These neoplasms love to go to the lungs and metastasize. Another thing that you might see in an older, especially a multiparous rabbit who's had a couple of litters, are these large dilated veins. These are known as endometrial venous aneurysms. They're often a congenital problem, so you see them in larger numbers in certain lines of rabbits. And this doe will probably start spotting. You'll see blood in the urine. They're not pregnant at the time, but they usually have had a couple of litters, and then it's easily surgically corrected by ovariohysterectomy. In the males, the most common testicular tumor, as we also see in mice and rats, is the interstitial cell tumor. These are generally benign tumors like we see in most other species. Rarely they can metastasize, but usually they are confined to the testis. And they've been reported to be associated with gynecomastia, but that was a single case report in VetPath. Rabbits will also get seminomas. Those tend to metastasize a little more in rabbits. Okay, let's look at the urinary system. Here's an absolutely classic picture. The normal kidney is on the left, and this somewhat shrunken kidney with a lot of divots and scarring in the cortex is absolutely classic for a parasite that we looked at in the last lecture about the nervous system. It's a microsporidian parasite called Encephalidozoan cuniculi. Very common in pet-raised rabbits, meat and fur-raised rabbits, backyard rabbits, but not common at all in the laboratory. I haven't seen it in a laboratory rabbit in years and years. But we used to see them all the time when I got started in pathology back in the dark ages. But we've cleaned them up in a laboratory rabbit, so unless you're looking at pet rabbits, you may never see this particular bacterium. Microsporidia affects two organs. It affects the brain and affects the kidney. Within the kidney, it lives within the proximal renal tubular epithelium, undergoes schizogony or sporogony. Actually, these are called spores. They are gram-positive. They're also birefringent. And if you get tired of searching for the intact cysts, it's a lot more difficult to find them when they've broken up and you have areas of inflammation surrounding single spores. But if you put a gram stain on this kidney or this brain, they're going to light up really nicely for you. And so what happens is they will undergo sporogony in the proximal convoluted tubule, in the second round sporogony in the distal convoluted tubules, and when they rupture out, you have inflammation of that tubule, expansion of the interstitium, deposition of scar tissue, and eventually that's going to contract, and you get these very characteristic divots within the cortex. Nothing ever looks like that in a rabbit. So you want to think about encephalitozoan cuniculi as a cause of interstitial nephritis and cortical scarring. You can also see this much less commonly in dogs and non-human and actually even humans, non-human primates and humans. Encephalitozoan cuniculi. Urolithiasis. We talked early in the first lecture about some odd things that rabbits do. And one thing that rabbits do is that they have a really odd calcium metabolism. They tend to excrete most of their calcium out in the urine instead of in the bile, like almost every other species. And because of that, you get a urine that is very turbid, and you get a lot of uroliths, not only within the urinary bladder, but also within the kidney. You can see here that there is a urolith here. There's a urolith here, which has occluded the ureter. We're starting to get a bit of hydronephrosis. There's obvious increased pressure because there is papillary necrosis. Probably not just from the presence of this urolith, but also the back pressure. Because remember, nothing tells the renal cortex to stop producing urine if the ureter is obstructed. There's no negative feedback, which seems odd to me. I think we would have some sort of warning system, but you don't. So these uroliths here, probably down in the bladder, are most likely going to be calcium carbonate. They tend to be a little softer than we expect with struvite crystals, or struvite uroliths, the most common urinary stone across animal species. They're a little soft, they're a little they're a little squishy, and they'll also have a fairly high level of magnesium, which is also excreted in the kidney by the rabbit. So calcium carbonate. And here's a big calcium carbonate urolith. A lot of times what you'll see is, especially in animals that have any type of damage to the nervous system, you're going to see a lot of sand and goo in the bottom of this. This one is well formed. The animal is probably passing urine around it. It may be associated with a concomitant urinary tract infection, but $1 to a donut. This great picture from Laura Bryan down at Texas A&M, that this is composed of calcium carbonate. This is not the classic divot that you see. We have a very thin cortex, not that classic, but it is sort of a lumpy, bumpy kidney. And this is chronic interstitial nephritis. Almost all of our rodents and our lagomorphs, as they get older, develop a wide range of disease of the glomeruli tubules. Rats have chronic progressive nephropathy, which is the prototypical chronic interstitial nephritis of all the rodent species. But I know that old rabbits, old mice, rats, hamsters, gerbils are all going to have aging changes in the kidney. Make sure that you don't overinterpret them. These are commonly overinterpreted as immune complex glomerulonephritis or something like that, just realize that old rabbits, like all old rodents, are going to have bad-looking kidneys if something else doesn't catch up with them first. Expect it and don't overdiagnose. Here's one you probably won't see too often unless you're watching the Wednesday slide conference where this picture came from. This is what used to be what's left of a kidney, and this is a large mass which has replaced it. This is a nephroblastoma. They are spontaneous lesions, and they also can be induced in young rabbits by the injection of various types of cancer-causing compounds, including transplacental ethyl nitrosourea, a common carcinogen, which used to be used. As the prevalence of transgenic rabbits becomes more and more popular, we'll probably start seeing transgenic models for renal tumors, as well as a lot of different types of tumors that you may see in rabbits. Okay, we're almost done. Only have a couple more slides left. I often put the endocrine system at the back of the lectures, not because I have any lingering malice against the endocrine system, but in laboratory species, not much happens there. One of the things that we see across all of our laboratory species is pituitary adenomas, like all of the other rodent species, like all the other laboratory species of note. These generally are prolactin secreting. They can be large, they can compress the overlying hypothalamus and cause problems. One of the things that they will do, because they are prolactin secreting in rabbits especially, is they are associated with mammary hyperplasia and or dysplasia. They've also been associated in rats with mammary hyperplasia, but the rabbit really tends to get a pretty obvious mammary hyperplasia in the presence of excessive prolactin that are secreted by these tumors. Well, that's it. I hope you've enjoyed these lectures on the rabbits. We've done most of the laboratory species. I'm going to do hamsters and gerbils, and then we will be done with at least my review of laboratory species. I'm not a big fish guy, so we're going to try and find some qualified fish lectures to talk about laboratory fish. There are some videotapes out there on the Foundation portal by Dr. Jeff Wolf, who is an absolutely fantastic lecturer on laboratory fish. So I encourage you to look those up. And thank you for your time and your attention. And please feel free to come back to the Foundation's YouTube page or Facebook portal, and I will continue to keep putting these lectures up that I hope are of interest to you. Have a great day.